My name is Leta Boylan, and I worked as an agency nurse in the psych hospital at North Central Healthcare in Wausau, Wisconsin, from 2017 until December of last year. North Central is a taxpayer-funded facility in my home county of Marathon. Patrick Snyder is my assemblyman. In 2022, they opened a brand new youth psych unit, and it quickly became the primary unit that I worked on. Many days, every single minor female patient was trans-identified. It was unusual for us to have no trans patients on a given day. Most teenagers experience suicidal ideation at some point. This is not a great part of the human experience, but it is also not an uncommon one. If a child who is struggling discloses suicidal ideation at school, it starts an unceasing cascade of interventions which occur without parental input or consent. School staff are legally obligated to report to law enforcement, who will remove the child to the emergency room, where the child is subjected to medical tests and placed on a 72-hour hold and then delivered to a facility like the one that I worked at. All of this is done without parental consent and sometimes without parental contact. The North Central administration, headed by an individual previously employed as an administrator at Lincoln Hills, who was forced to step down during the investigations, had an unwritten but brutally enforced policy that clinical staff were to, quote, call the kids whatever they want to be called, end quote, and that we were not to inform the children's parents of their desire to socially transition. Children as young as 11 years old, wanting to both impress and fit in with their somewhat older peers, would frequently change their names and pronouns, and this would be kept a secret from parents. Clinical, educational, medical, and mental health professionals of perceived authority, who had already proven that they could override the wishes of the child's parents, were now also in the business of hiding things from the parents. There is no acknowledgement on the part of these administrators, who never interact with patients, that affirming a cross-sex gender identity in children is not a psychologically neutral act, and in fact starts another unstoppable cascade of interventions. But this one ends in permanent sterility, disrupted endocrine systems, sexual dysfunction, mutilated genitalia, and an increased risk of completed suicide. To a person, every single trans-identified minor female patient that I took care of described herself as either autistic, same-sex attracted, or a survivor of sexual assault. Every single one. Some were all three. Most were on self-harm precautions and presented with significant self-harm scarring. The trust that parents and families put in us to care for their beloved children is an awesome responsibility. The parents of my community pay a millage to fund a facility that usurps their rights and engages in iatrogenic harm that is perpetrated against their children. How will they ever trust us again? Due to my professional experience working with trans youth, I urge you to support AB 104.
Right. Thank you. Do we have any questions? All right, Representative Snyder.
Thank you. Well, thank you, Fan. Thank you for your testimony. Why do you think the administration was so keen to socially transition children?
I don't think that they want to be bothered with the kind of long-term therapeutic interventions that are required to truly and completely address what are behavioral health issues. They are an acute care facility, and the administrators, the physicians are a fine group of people, the clinicians are top-notch, the administrators are effectively accountants. And when they get that 4-day stay, they bill Medicaid and they kick them out and they start the process over again. So the reason that unit was built was because of community demand. The community demand is in the trans-identified child community. Those Venn diagrams are a circle.
You don't worry about any retribution from the North Central Health?
I am no longer employed there.
Oh, okay. I was going to help if you would. All right, thank you.
Representative Wickers, and then, yeah, he was first. Oh, okay.
Oh, I didn't care.
Go ahead.
I just want to make sure you had me on the list. Go ahead.
Go ahead, we'll yield.
I just want to be clear, because this bill is not about pronouns or anything like that. This bill is about gender affirming care. I just want to be super clear that I'm sorry, which facility were you at?
North Central Healthcare in Wausau. I worked in both acute psych units.
Okay, so at North Central Healthcare in Wausau, Are children being provided puberty blockers or hormones without their parents' consent?
That is not something that I have the ability to answer because my psychiatrists openly said this was a fad and they refused to prescribe those. However, children would come in with outside medications where we would be required to dispense them, which did include cross-sex hormones, yes.
Okay, so the answer was that they weren't being given or prescribed
Incorrect, ma'am. That is not what I said and that is not what I indicated.
without their parents' consent.
There is no way for me to know what an outside provider did. There
Okay.
is no way for me to know that. That was
Fair enough,
outside
fair
the
enough.
scope of my practice.
I've got it now. So, to your knowledge, because you,
I have no way of getting said knowledge. I
Okay.
do not work for the kind of doctors who do this to children.
okay, and you understand that this bill doesn't address pronouns, for
I'm sorry,
example.
ma'am, were you the person who said that you had a degree in psychology?
Yes.
Okay, then I feel like you would probably understand that any psychological intervention under the auspices of what is reimbursed from healthcare is considered treatment. An affirmation of a cross-sex gender identity is in fact treatment that was being performed on children without the knowledge or consent of their parents. That's a fact.
All right, and so, again, I'm just going to walk this back and say, to your knowledge, because you were making some fairly strong statements about one of our healthcare facilities.
I'm
I just
aware.
want to be crystal clear that you can't provide any examples of children being given puberty blockers or hormones without their parents' consent. Is that correct or not?
I am also unable to provide you with the sales numbers from the Subaru dealership. That is outside my scope.
Great, thank you very much. I won't ask you for those then.
Representative Wickers.
Thank you, Mr. Chair, and thank you for your testimony. One of the questions that I had earlier and tried to connect dots, I don't know if you can answer this. I'm trying to track, for the sake of the bill, with minors, and I'm getting a sense that they're coming from, whether it's national or local, that they're getting affirmations from their schools, their peers, their teachers, maybe administration. There's all kinds of dots getting connected here. Once these minor children access, whether it's with their parents or without, hormone blockers, where are they getting predominantly these hormone blockers? Who's the largest provider of this?
The largest provider is Children's of Wisconsin and then Boylan in Green Bay and the Medical College of Wisconsin. The most recent numbers that I'm aware of are from 2022. So I would presume that they've exploded since then.
So, thank you. And would that be being prescribed and dispensed?
It depends. Some of those places have inpatient pharmacies and some of them do not. Some facilities, like the one that I worked at, have an inpatient pharmacy. So for example, if a young man with a trans identity who is taking 4 times the amount of estradiol and progesterone that are in over-the-counter birth control pills comes in, we being North Central, would dispense that from our pharmacy, but only for the duration of his visit there. The rest he would have at home, and he might obtain them from Walgreens, or he might obtain them from the pharmacy at Wisconsin Children's. It really depends.
Is based on connecting those dots, I don't know what question to ask. Is there something that I'm missing that was part of your testimony that wasn't written down, that questions that we should be asking?
I mean, I would love to see the assembly investigate what's going on there. That is my personal goal out of this testimony, and my professional goal would be for you to consider, since we have been discussing cultural matters at length during these testimonials, that not having legal guidance around this kind of care has created an absolute bankrupt ethical standard, which the environment at the place that I worked was the wild, wild west. Anybody does whatever they want.
Okay. Any other questions?
Last
Stick
question.
to the bill. We're getting.
Yep, last question. So the bill is saying that you can't provide the therapy or surgeries to minor children.
Correct.
To help, not harm.
Right.
That's what the author called it. The providers that are prescribing knowing that it may violate their prudential judgment for what's best for the child at that moment. In some cases, you alluded to, in other words, is there a pattern in healthcare where the providers are becoming medical technicians and the administrations or the accountants or the model is saying, get the reimbursements and we'll worry about your conscience?
I believe that I'd like to paraphrase a little bit because I think I see what you're getting at, but I'm not sure. Where I worked, and it is my understanding that this is very common in similar fields, the administrators, most of whom either had a master's of education or a master's of social work, with regularity overrode the wishes of the psychiatrists. And that is well outside this issue, but it's also specific to this issue. That does happen frequently.
That connects the dot.
Yeah.
Thank you.
All right, any other